Hi, I'm Joe, and this is the second corresponding video to the Cultural Competence Assignment. In this video, we're going to be going over the case study for Jacu Sky Redbird, and we're going to be looking at details in the assessment before we move on to the intervention where we incorporate cultural competence and cultural humility. So starting with the assessment, the patient is a 41-year-old female of Native American descent who presents with acute hepatitis and type 2 diabetes. The patient also has a history of Sjogren's syndrome, high cholesterol, GERD, NASH, restless leg syndrome, sleep apnea, and has asthma, but the asthma was more prominent as a child. The patient denies smoking and drug use, and also intakes 1 to 2 alcoholic beverages per week, so very limited. Both of the patient's parents are alive and have type 2 diabetes and hypertension. The patient also has one living sister who also has hypertension as well as high cholesterol and hyperthyroidism. The patient is at moderate fall risk, and also taking into account some of the allergies, the patient is allergic to sunflower seeds, plaquenil sulfate tablets, and methylprednisolone tablets as well. Okay, so moving from the assessment to the intervention, the first thing that we want to establish is that there are a lot of different tribes. So we really want to acknowledge the tribe that this individual is from, because they all have different practices, languages, all the cultures are very different. So acknowledging this specific patient's tribe. The second thing that we want to do is build a rapport with the patient through motivational interviewing. Respect is a very big deal in Native American culture, so really want to start establishing rapport early. It's also very important that between the RD and the patient, in this case, Jacu Sky Redbird, we want to teach each other. The RD providing nutritional education and the patient providing information about their culture that we can then take and incorporate into meal plans and behavioral changes. That way we respect the patient's culture. So when we're talking about important information, I'm talking about asking about what reservation life is like. That means kind of getting a gauge of like the grocery access, foods that are prevalent in that culture. We're also acknowledging the fact that there is traditional medicine, the traditional medicine aspect. That's a very big deal in Native American culture. And then also incorporating traditional foods and how those foods are prepared into our meal plans and our interventions. And speaking of which, interventions for this patient include frequent small meals. We also want to focus on a low-fat diet, focusing on lean proteins, whole grains, vegetables, and then limiting fatty foods. We want to make sure that the patient gets 130 to 200 grams of carbohydrates daily, focusing on complex carbs. We want the patient to stay hydrated and ensure electrolyte balance. And then we also want to ensure that the medication that the patient is taken with food to mitigate any of the side effects of that medication. So taking those interventions and combining it with the information that the patient provides to provide care that is culturally competent and incorporates cultural humility as well.